Welcome back to Fox 10 News at 4. You know, the coronavirus is taking a hold on more and more of our younger patients recently. They're dealing with heart-related issues, and we want to know what's causing that and also talk about the benefits of those receiving the vaccine. So we have a cardiologist, a pediatric cardiologist in the studio right now to talk more about this. Dr. Nayar is joining me now with more on this topic, and my apologies. We were just discussing the importance of getting the COVID vaccine, but we also talked about the hesitancy that's attached to that.
Yes, thank you, Lenise, for having me. So what we're seeing here is a Delta variant of the initial virus, and as opposed to the previous mutations, we're seeing actually our children being more affected. So previously it was known as a disease where children were asymptomatic and having mild disease. Unfortunately, that's no longer the case. In our own Children and Women's Hospital, we have 18 children who are currently admitted. We're at capacity. We have 11 on the floor, 7 in the ICU. Out of that 7, 4 are intubated. I also had a harrowing week on call where I had a child who basically had severe inflammation of the heart muscle, and we did everything we could here, and we had to transport her out, and she needed to be on the highest circulatory support we know of, which is called ECMO, and she is trying to recover. So we are seeing a devastating effect on children and young adults now.
Is this all the Delta variant? Is it a combination of the lack of vaccinated people in the population, or what is it?
I think it is both. I do think that we have documented evidence that about 60% of the variant that we're seeing in the United States now is the Delta variant. We know that the Delta variant is more contagious. We know that there's less time for exposure and you can get the disease. Possibly why children are being more affected. Interestingly, we're actually seeing younger children as young as 3 weeks old who are coming in, who need hospitalization, who need a breathing tube to breathe. This is all very, very concerning. The most important point here is we have very minimal pediatric resources in the United States, and many pediatric beds are maxed out in all our neighboring states, and we are all, as pediatricians, getting very desperate as to how we'll take care of all these children.
And another concern of that is it's not just COVID, but you're expecting to see something else later down the line.
Yes. So in the initial phase of COVID, we were actually not seeing acute COVID taking down children. We were seeing more at 3 to 4 weeks, a multi-system inflammatory syndrome in children, which was 3 to 4 weeks after getting acute COVID. They could be asymptomatic and then in 3 to 4 weeks get a fever, have their heart function down, and need a breathing tube. Now we're afraid, we're seeing acute COVID, we're going to max out our beds, and then in 3 to 4 weeks, what next?
What can we do?
I think at this point, about 4 things. Vaccinate if you're eligible for vaccination, that is above the age of 12, and that's including all pregnant women. Please vaccinate. Hand wash, mask up. This virus is more transmissible. And if possible, social distance. And those are all the things that we need to continue to do.
Yeah, it's going to be a marathon, not a sprint.
Absolutely, and it has already been a marathon. It's been almost a year and a half off this.
I appreciate your time. So much to cover in a short amount, but a lot of good information there. Thank you so much. And we'll be sure to have this posted for you on our YouTube page so you can share it with someone you know. Look for it shortly after this newscast.